I was wondering if you could explain to everybody in the room, particularly liberals in the room, why universal health care is fundamentally a bad idea and how free market health care would actually solve high health care prices.
So let me address two big myths right now with health care. The two biggest myths. Number one, that somehow we have never tried single-payer health care. And number two, that we somehow have a free market in health care. Okay? So let's do the first myth. We have examples right here in America of people that have a version of single-payer health care. First and foremost, Medicaid. Okay? So a poor person does have health insurance coverage provided by the federal government. By the way, Medicaid, a lot of times, is very, very low-quality care. It goes to lower-rung hospitals, and it is something that, quite frankly, we should not be totally proud of. Now, the other example they'll use is Medicare. Well, what has Medicare done? There's over $60 billion a year in waste in our Medicare program, has done nothing to address the quality of care or the price of health care. So there's a difference between health coverage and health insurance and the quality of health care. We'll get to that in a second. But we also have an example of total government-run health care, where the government controls the doctors, the facilities, and the pricing, and that's the VA. That's the Veterans Administration. That is Cuba-style run government health care. The VA is a disaster. $180 billion a year we spend on the VA. Over 50% of expenditures on the VA is spent for administrative overhead. If the Cleveland Clinic had more than 5% in administrative overhead, they'd be shut down. Just to give you an example of what, the Cleveland Clinic would not be allowed to get even close to 50%, let alone 5%. Just to give you an example of the VA versus more of a private free enterprise type juxtaposition. So, but the second myth is we don't have a free market. You cannot buy health insurance across state lines. We have a quota for doctors. We have so many different government regulations and barriers that are not market principles. So healthcare is such a mess right now. And it's a mess, first and foremost, because no one knows the price of anything. Candace, do you want to talk about this for a second?
I actually don't want to talk about it for a second.
Well,
it gets me so mad to understand how they literally try to hide prices. I mean, I'm talking about it for a second. I went to the hospital in Dallas because I had an allergic reaction on the plane. I was in the hospital because I have asthma. I'm there for literally an hour and a half. I get back home and I get a bill for $2,000. I'm like, I don't know what I did. I literally had an ass treatment. All I know is that this should not cost $2,000. Now, they don't tell me what it's for. It just says $2,000. So I call and I say, oh, do you mind sending me like an itemized bill? Oh, we don't send itemized bill. What do you mean don't send itemized bill? I want to know what I'm paying for. Oh, well, we're going to have to wait 15 days and we can send you something. Okay, I'll wait 15 days. That's absolutely fine. Just so you know, I'm not paying this bill until I see what it is. I get the itemized bill some 15 days later, and it's like code GBL393733. $500. Code 767. I'm like, okay, what is code 7399999? Oh, I don't know what that is. The doctor punches that in. Okay, what is it? Literally, I am still to this day do not have an itemized bill. This was in June. I'm still trying to figure out what the heck they gave me at the hospital that cost $2,000 for an hour and a half. And this is a problem with our healthcare system because there's some like quid pro quo that exists.
With the insurance companies and the hospital. They have an agreement. So
and we're left out of it.